Hello, I'm Dr. George Case. I'm a chiropractic physician here in Garner, North Carolina. And in addition to being a chiropractic physician, I also like to do work with neuropathy. This could be diabetic neuropathy, neuropathy from heavy metal exposure, some other environmental problem. But I want to talk about neuropathy because it appears from all the patients that I've treated that they're not getting a good background from their physician. So let's talk about this. Where does it come from? What does it look like? What is the age group that we're looking at? Age group, let's look at that one. This may surprise you. You may find people in their 40s that have peripheral neuropathy. This is hard to believe, but the average person that we see coming through for treatment of neuropathy here at the clinic is 65 to 80, some a little higher than 80, but pretty much that's the window that we're looking at. Maybe I could say the average is in their 70s. There's some things that you need to understand about this program. There is no other program like this in the area. I don't think there's another program like this in North Carolina, but I haven't been out there looking around. It requires some input from you, and you'll find as we talk about this in the office, I kind of put the cards on the table. There's things you need to know, and we don't need to be sugarcoating anything. I'm looking at neuropathy as something that destroys the quality of life. As you can see from this white hair, I've been around a long time. I've been in practice over 35 years. And quality of life that I see that is failing is people they're losing their balance. They are deathly afraid to fall. Now we know, and most of you know because of the internet, that when you fall in your 70s or 60s, the chances of breaking a bone are really, really good. Unfortunately, the statistics show 50% of the people with that broken bone won't be here in a year. They end up in a nursing home somewhere. Their body just isn't capable of repairing that problem. So quality of life is the big one. What do we see? What do we see in the patients that are coming in here? Numbness, yes. Tingling, yes. Burning. Not everybody has burning, but the ones that have burning are beside themselves. They don't know where to go. They don't know what to do. They've tried the gabapentin. They've tried all the Lyrica, all these different drugs that were not made for neuropathy. They were made for something else like depression or anti-seizure drugs. And the physician thinks maybe this will help them. But usually the side effects are as big a problem as the drug or the problem that they have. People can't feel hot and cold water. Their coordination is off. Their dexterity is off. They can't do things like button a button or tie their shoes. You'll see a lot of people with Velcro. Because even though the majority of the neuropathy that we see is in their feet, we see some people with it in their hands. Muscle weakness, difficulty just lifting your leg up to get in the car, walking, stumbling, walking across the carpet, walking across the room, and you catch your feet on the carpet. Perfectly smooth floor, but you're catching your feet on the carpet. You're stumbling, you're falling. You go to a nursing home and you see people walking around like this, looking down at the floor. And I've heard people in the nursing home visitors say, "Oh, the poor man is so depressed." He may have a depression problem, but his biggest problem, or her biggest problem, is she doesn't know where her feet are. Because there's a disconnect between her brain or their brain and their feet. Now, what do I mean by a disconnect? We all know there's an autonomic nervous system, which is your brain and your spinal cord. I like to say it works our body automatically. Autonomic, automatic. We don't have to tell our heart to speed up because we got to run across the road, there's a car coming. We look, our eyes assess the situation, and our heart starts to beat and we start moving as fast as we can. Automatic, autonomic. Now, when those nerves come down the spinal cord and leave the cord and get out into the arms and the legs and the feet, that's called the peripheral nervous system. That's where we get in trouble. Now, the long nerves, usually called large diameter afferent nerves, are coated with something called myelin. The myelin sheath is a fatty coating over the nerves. Because they're so far from the brain, it helps to speed up the message from the brain to the feet or the hands, and from the hands or feet back to the brain. When the myelin sheath starts to break up on those nerves, it could be from diabetes. You could be pre-diabetic, or you could be a type 1 diabetic. But high blood sugar is one of the major causes of neuropathy. It causes nerves to be destroyed in the legs, and it kills nerves in the brain. We need to be aware of what our blood sugar is. Ideally, our blood sugar should be around 90, 92. And I know some doctors show you the blood work, if they show you anything at all, and you see this range from 65 to 99 is normal. You can't function at 65. You can't function at 65. So, blood sugar is a big problem. Another big problem is statin drugs. Statin drugs that are used for cholesterol lowering also are a problem for peripheral neuropathy. They cause peripheral neuropathy, or they may cause it. They also may cause brain issues like cognition, the ability to think, reason, put things together. Think twice about the statin drugs and look at your cholesterol, talk to your doctor about this, question the doctor, do you really need as much, or do you really need that medication? Okay, so we're going to get you out of your comfort zone because we're going to bring you in here 3 times a week, and we have a multitude of different medical devices that you won't find around this part of the country that we use specifically for neuropathy. We also use them for knee problems, for the people that have a lot of knee problems, even frozen shoulders. But for this particular video, we're going to just be talking about neuropathy. You need to be committed. You really do. When you need to come in here 3 times a week for 10 weeks, that is a commitment that you have to make before you start this program. I'm telling you all this up front so there's no surprises when you get here. You have to believe in yourself that this is something that will help your quality of life. And once you start to get the feeling back and the pain goes away, you'll see that your balance starts to recover. I see it every day here. It's always fun to listen to somebody say, "Hey doc, I felt the hot water on my feet for the first time in 15 years. It's not a big deal to a lot of people, but it is to that patient. It is to me because I know that I've made a difference. Priority is a big thing in this treatment, because if you have a long distance to travel, you need to think twice about starting the program. Now I had a gentleman come here from east of Wilson. He was traveling an hour and a half one way to the office. Most people that start the program that live that far away don't finish the program. So think twice about getting into the program when you live that far away. Because again, it's 3 times a week for 10 weeks. 30 visits is the average amount of time it takes to achieve a good to excellent recovery. I'm not going to say we do 100% recovery. I'm not going to say that we help every single person that walks in the door. It wouldn't be fair to you. But I think that it's fair to say that we're looking at an 80 to 90% of the people that come in here, that go through the whole program, are happy where they are when they get through. They've got their life back. So, I'm going to flip over from here into a PowerPoint program that will go through a lot of this. Remember, you're on a DVD, so you can back all this stuff up. If you didn't understand something I said, or you didn't hear it right, back it up and listen to it again. You may want to listen to the DVD 2 or 3 times. Many people do before they ever get in here. Hello, I'm Dr. George Case, and this is my attempt to educate people on functional neurology, functional medicine, and how we treat peripheral neuropathy. I find a lot of people come in here for the examination and I give them a ton of information. Unfortunately, it's foreign to them and it's impossible to remember all the information that I give to these people, so it's also very difficult to make an intelligent decision on getting treated for this. So this is a slideshow that I use in my workshops, or when I do group workshops around the Raleigh area. So what we're going to talk about is functional neurology and functional medicine. And when I say peripheral neuropathy, it could be diabetic neuropathy. They're both being treated the same, and they're both very successful. What is peripheral neuropathy? What causes it? And what can be done to restore your peripheral neuropathy to health? First of all, it's very common. As we get older, or if we have diabetes, it's almost a given. Sooner or later, we're going to run into neuropathy. Chronic disease affects 20 million Americans. Look at your nervous system as electric wiring breaking down in a building. Your feet and your hands can't communicate to the brain. The brain can't communicate with the feet and the hands. So what does it mean? Peripheral means further out from the center of the body, a long ways from the brain and the spinal cord, as in feet and hands. Neuro means nerves, pathy means abnormal. There are 10 signs of peripheral neuropathy, and I see every single one of these almost every day of the week. Numbness. It could be in your hands, but more likely it's in your legs and your feet. Many of you have it from about mid-calf down to your big toes. Burning feet. This can be the top of the foot, it can be the bottom of the foot, it can be both. Cramping in the legs, especially at night. Sharp electric pain. Pain when walking. Some of this pain is so sensitive that people can't lay in bed with their sheet on their feet. It causes really, really bad pain. Difficulty sleeping from leg discomfort, prickling, tingling feelings, loss of balance and falling. Loss of balance and falling from people that don't know where their feet are because their feet, I should say that they can't feel their feet touching the floor. Weakness in the muscles in your legs and swelling.
legs and feet, could be hands and arms, but what we see primarily are peripheral neuropathy of the feet and legs. Symptoms depend on which type of nerve is affected. The three main types of nerves are those that carry sensations, called sensory nerves, those that control muscles, that are called motor nerves, and those that carry information to blood vessels, which are the autonomic nerves. Obviously, sensory nerves, you can feel this is where the pain is coming in. Motor nerves affect our ability to walk, and the autonomic nerves, they control our digestive system, our heart, our lungs, all the systems that we don't think about because they're working automatically. Damage to the sensory nerves result in changes in sensation, causing the burning sensation, the nerve pain, tingling, or numbness, or an inability to determine joint position, which causes balance problems. For many, neuropathies, sensation changes often begin in the feet, progress up towards the center of the body with involvement of other areas as the condition worsens. This is a progressive disorder, meaning it just gets worse. Movement difficulties. Damage to the motor nerves interferes with muscle control and can cause weakness. Loss of muscle bulk and loss of dexterity. Sometimes cramps are a sign of motor nerve involvement. All chronic health conditions have some common threads. When you look at the column on the left where you see peripheral neuropathy, thyroid conditions, insulin resistance, diabetes, fibromyalgia, vertigo, sciatica, chronic fatigue syndrome, hypertension, chronic neck and back pain, stenosis in the spine, irritable bowel syndrome, insomnia, migraine, or chronic headaches. When you look at that whole list, the list on the right side, the metabolic imbalances, and you can read them, and the neurological imbalances, one or the other or both of those problems are causing all the issues that you see on the left column. Chronic illness is a combination of neurologic and metabolic problems requiring proper neurologic treatment and metabolic treatment. Let's stop right here for a second. Neurologic is 60%, metabolic is 40%. You are given two forms, and sometimes people